Here we are going to give an overview related to the health promotion. So, we believe that the study of health behaviors in both healthy and unhealthy population is an important area where health psychology can and has made important contributions to improving health. So, when talking about the area related to both healthy and unhealthy people, health psychology can do something related to the contributions of improving the health strategy or health behavior of the people. And health promotion is a philosophy that has at its core the idea that good health or wellness is a personal and collective achievement. For the individual, it involves developing a program of good health habits. So, when talking about the health promotion, so it becomes the idea that to attain or to attain the good health both physically and mentally, or the psychological well-being or the wellness of the person, and also the personal and collective achievement of that person. So, these all areas all together leading to the health promotion of the individual. And for the individual, it involves developing a program of good health habits. So, in the case of health promotion in the personal level or in the individual level, so it is they have to develop good health habits. And for the medical practitioners, health promotion involves teaching people how to achieve a healthy lifestyle and helping people at risk for particular health problems offset or monitor those risks. So, in the case of medical practitioners, their duty or their wellness is to promote the mental health or health promotions, or teaching the people how to achieve the healthy lifestyle, and also help the people who are having at the risk of any of the health problems related to that. And also they have to monitor these risks what the people are having. And when it comes in the case of the role, when we are taking the role of a health psychologist, how they will be promoting that. And health promotion involves the development of interventions to help people practice healthy behaviors. They will be playing with the behavioral pattern of the people, or for the development of the health promotions. And they will also make some of the development of the interventions to help or to understand the people how to practice the healthy behaviors. And for the community and national policy makers, health promotion involves emphasizing good health and providing information and resources to help people change poor health habits. So, it is what the national agencies, or it is being done by the family welfare department or the health departments, like making some of the policies, national policy makers, that or the community level workers, social workers, that they will be promoting the health promotions through providing the informations and resources to help people to change the poor health habits. So, here we have a good example for that, the problem what we are facing right now, that is the COVID-19. So, here the national policy makers are making some of the standardized rules to go through the people, or the individuals has to be go through some of the policies, like some of the rules and regulations to be followed, and it also be done to maintain the health promotion, that is to avoid or to change some of the poor health habit of the people, like cleanliness. So, you have in the current situation the promoting the good health, and that is using sanitizers or some wearing of the mask. So these all includes some of the policies that the policy makers are being done in the community level to change or to promote the health. Yes, health behaviors and health habits. So health behaviors are behaviors undertaken by people to enhance or maintain their health. So we know that it is a kind of behaviors that are taken care by the people to maintain or to promote their health. Okay, a health habit is a health behavior that is firmly established and often performed automatically without awareness. These habits usually develop in childhood and begin to stabilize around age 11 or 12. So health habit is a kind of a health behavior, and that would be established and it is performed automatically. Okay, and this habit usually being performed start to perform from the age of childhood, and it will be established at around the age of 11 or 12. Some of the behaviors or some of the uh, behaviors that are performing by the childhood itself, that includes or some of the characters that are being stabilized, like wearing a seat belt, brushing one's own teeth, and eating a healthy diet are examples of these kinds of behaviors, and it becomes a health behavior, and it acts as a health habit. And some of the health habit may develop initially because it is reinforced by positive outcomes such as parental approval. It eventually becomes independent of the reinforcement process, and we know that in the case of childhood, this health habit may be developed because the child are being getting or the children are being getting reinforced by giving some of the positive outcomes for doing that behavior. For example, if making a possible uh, toilet training, and in case of brushing the teeth, and they will be rewarded or they will be getting some parental approval for that behavior, and eventually it becomes independent of the reinforcement process, and it becomes an healthy habit of that child later in his life. And the scientists focused on several important health habits like sleeping 7 to 8 hours a night, and not smoking, and eating breakfast each day, having no more than one or two alcoholic drinks each day. So it becomes some of the areas or some of the important health habits to be followed. Yes, talking about primary prevention, that is in the first case itself, that not to get into the illness. So primary prevention is installing good health habit and changing poor ones in the task of is the task of primary prevention. So that is installing some of the good health behaviors, and we can change the poor habits or poor health behaviors that is followed by that person, and it is called a task of primary prevention. This means taking measures to combat risk factors for illness before an illness has a chance to develop. So that is taking care of some of the measures to avoid the illness and not to make a chance to develop of that illness. For example, the primary prevention that we people are taking today for against the coronavirus or COVID-19, that we are taking care of the risk factors, like uh, we are taking some of the factors like social distancing, wearing mask, or using of sanitizers, and some other washing our hands before or after when we are coming back to home. So these are some of the measures we have to take care not to get into the illness. And there are two general strategies for primary prevention. The first and most common strategy is to get people to alter their problematic health behavior, such as helping people lose weight through an intervention. And the second one, more recent approach, is to keep people from developing poor health habit in the first place. An example of this approach that we can see that smoking prevention programs with young adolescents that we are conducting today to be avoid and keep people from developing these poor health behaviors. That is the first thing that people have to do. Practicing and changing health behaviors. An overview, we can see that we have to follow some of the practices and we can automatically change the health behaviors. And what are the factors, or what factors lead one person to live a healthy life and another to compromise his or her health? And what are the factors leading to a person to live healthy and to compromise his or her healthy? And the first one, there are some factors we can see here, that like demographic factors and age of the person and values of the person and personal control, social influence, knowledge and intelligence, personal goals and values, access to healthcare system. So these all are the factors that lead the person to live a healthy life and to compromise with his or her life. So we'll discuss the points or the factors one by one in the upcoming slides.